The IFCR's CDKL5 Centers of Excellence help affected families access a team of multidisciplinary specialists. The clinic model eases the burden on families by bringing all specialists together, saving families time and hassle while ensuring that their medical team is able to work together. Each CDKL5 Center of Excellence team consists of a variety of specialties, including, but not limited to, epilepsy, genetics, gastroenterology, physical medicine, rehabilitation, and palliative care. Our CDKL5 Centers of Excellence work to continually advance our understanding of CDKL5 deficiency disorder. They are researching how the condition unfolds so that standards of care can be developed for this disease. IFCR sponsorship makes the CDKL5 Centers of Excellence possible. We provide the coordination that brings the specialists together and fund the multi-center research. Hear from Dr. Tim Benke about what you can expect when you visit the CDKL5 Center of Excellence in Denver, Colorado.
So we offer a clinic that's tailor-made, we think, to the needs of the patients that come to see us here in Colorado. And those needs, they can be different from if you're from a different part of the country. Specifically, we have families that live down the street from where we are, but we also have a lot of families that we take care of that drive from Kansas and Nebraska and Wyoming and the southern corners of Colorado, and they'll drive 6 hours to get here. And so we set things up to make things as easy as possible for families. You need a one-stop shop, and so that's what we designed for you, such that you can get all of the people that you need to see as much as possible done in that one afternoon or morning when you're coming to see us. So when you come to see us, you come to one place. You don't have to truck all over the hospital because mobility issues can be a challenge for some of our families. So you come, you stay in one room, and all of the providers come in to see you while you're here. When you come to see us, it depends if you're a new visit or if you're a follow-up visit. If you're a new visit, we throw everybody at you in an afternoon. So you see neurology and genetics, and a genetics counselor, physical therapy, rehabilitation medicine, nutrition, dietitian with gastroenterology. You see developmental pediatrics with a sleep psychologist, cardiology, an occupational therapist, a speech language pathologist, and an orthopedist if you need to. We also have a social worker available for families that need social work services. And that can include anything from guardianship to different vouchers. So you come to see us, we check you in about noon, and you are here for several hours while this group of folks do your evaluations. We are not meant to take the place necessarily of your hometown physician. We want to work with them to help them provide the best care possible. So this is a partnership. You have to come to see us from far away. It's always good that you have your local people, and we want to work with them because that's what's going to make our community better. So that visit, it can last several hours if it's a new patient visit. If we're seeing you for a follow-up visit, you'll only see neurology, dietitian with GI, and rehabilitation medicine with the physical therapist. Sometimes if you have extra needs, we pull in other people to make that visit work for you as needed. By the way, who's the person that's pulling the strings to get us all to be here at one place? That's our nurse coordinator, Tristan Dinkle. It takes a lot of work on the side to get everybody together. And if I could put a plug in to how we're able to do this, that we can meet your needs over such a period of time, is we send you questionnaires that are clinically related, such that you fill them out before you come see us, before we see you. We review those a week ahead of clinic. So you need to turn them in more than that so we can review them and make sure that we make the visit that's tailor-made to what your needs and your questions are during the visit. You advance CDKL5 research by your visit to the Centers of Excellence, because what we're doing is two things. First of all, We incorporate aspects of our U01 grant to develop outcome measures into the clinical visit as much as we can. And that includes specifically the type of physical exam that we provide to your child. But the other thing that we do is once we know you, when clinical trials come along, we are able to reach out specifically to you to say, we have this trial, are you interested? So that's what's important about being seen at a center of excellence with regards to research. One of the questions that comes up is how much does it cost for your visit to a COE? Is it covered by insurance? And this is one of the things that Tristan Dinkle, our nurse coordinator, does when she works with the hospital. When you come in for your new visit and you're requesting this, is we're working to get this covered by your insurance. Sometimes, most of the time it is. There are some instances if you come from out of state and you have Medicaid there, some states will not allow their Medicaid to be used out of state. This happened to us in the past with an individual who wanted to come see us from a state in the southeast corner of the country, and their state Medicaid would not allow them to come because they felt that they had specialists in their state. What do I like best about seeing CDKL5 families? Well, that's a no duh. Families are the best. They're here because they want to do the best for their family member, and we're here because we want to do the best for them. And it's a very positive experience in being able to have such a great group of people that we work with, and we're all here to provide that tailored care for you and your family. And it makes for a very enjoyable experience for me. Enjoyable in the sense that I think that what we're doing is rewarding to patients, their families, and the greater community at large.